Let's talk about an extremely important topic for patients, which is the use of cancer next generation sequencing. So, next generation sequencing is the most sophisticated and advanced type of sequencing that it's available to identify the specific molecular abnormalities or molecular characteristics of a patient's cancer. So essentially, what we do is we take a biopsy or a piece of the cancer of a patient, and we send it to a sophisticated lab that will help us identify those particular molecular alterations. Now, the most important reason why we do that is then to understand the makeup of the cancer at the molecular level and to help us guide treatment decisions so that we can provide the patients with a plan that is personalized to them and that it will be more effective than traditional treatments with chemotherapy, and that will also have potentially less side effects. But mainly we're looking for way better efficacy, better results when we do use this type of technologies and based our treatment decisions based on this information. Now, in particular, it is very important to know that there are, regardless of the type of cancer, right, there are many medicines, many drugs that can be used as long as we find one of these molecular abnormalities. So I'm going to take some time just really quickly to just mention some of the drugs that have FDA approval just based on the molecular abnormalities alone, right? These type of FDA approvals are called tissue agnostic approvals, in which it doesn't really matter what type of cancer a person has, as long as they have that genetic abnormality, then they can be treated with that particular treatment. So then, just to mention a few, then we have that the use of Keytruda or pembrolizumab is approved for people that have microsatellite unstable or high mismatch repair deficient cancer. Now, the same type of approval we have it for dostarlimab or Jemperli. Now, we also have an approval for cancers, people that have cancers that have a high mutational burden. And this is defined as more than 10 mutations per megabase. In this case, pembrolizumab is approved as well. Another molecular abnormality, it would be NTRK gene fusions in solid tumors. In this case, then larotrectinib, or also known as Btracb, can be used for these type of cancers. And same thing with entrectinib can be used for people that have NTRK gene fusion solid tumors. Now we move on to another fusion, which is the red fusions. Once again, red fusions are also in the list of FDA approvals, in this case for selpercatinib. Selpercatinib can be used in these patients. And one of the newest approvals is for Enhertu or FAM trastuzumab deruxtecan, which was just approved by the FDA in April 2024 for the treatment of cancers that have HER2 positivity, the HER2 positive by immunohistochemistry. Now, in this case, however, though, next generation sequencing does not catch this one. So these ones need to be, HER2 positivity needs to be tested independently of a next generation sequencing panel. So just very important also that, to keep that in mind, that that's not part of the next generation sequencing panel. Now, moving on to something that is part of next generation sequencing panels would be your BRAF V600E mutations. These are present in many solid tumors, um, like lung cancer, for example. And if they're present, then that may make the patients eligible to treatment with dabrafenib if they have no other alternative treatment options. And then finally, FGFR1 rearrangements for people that have relapsed or refractory myeloid or lymphoid neoplasms. Anyway, the takeaway is that every patient with metastatic cancers, especially solid tumors, should be tested with next generation sequencing to see if they have any of these molecular markers and are eligible for treatment with these tissue agnostic drugs. And that's essentially the power of next generation sequencing, because it can offer new treatment options for patients that otherwise don't have satisfactory alternative options. Thank you so much for listening, and see you later. Talk to you later. Bye.